Hello friends, I'm Dr. Shuchita Batra. I'm a board certified cosmetic gynecologist practicing in Ludhiana and आज हम लोग डिस्कस करेंगे लेबियाप्लास्टी के लिए कैसे प्रिपेयर किया जाए। इससे पहले वाली वीडियो में मैंने आपको बताया है कि लेबियाप्लास्टी क्या होती है, क्या क्या मेथड्स होते हैं उसको करने के, एज वेल एज कौन से उसके कैंडिडेट्स होते हैं जो कि लेबियाप्लास्टी करवा सकते हैं और जिनको करवानी चाहिए। आज की वीडियो में हम लोग ये देखेंगे कि कैसे आप लेबियाप्लास्टी इफ यू हैव डिसाइडेड और इफ यू आर अ कैंडिडेट कैसे आप अपने आप को प्रिपेयर कर सके लेबियाप्लास्टी के लिए ताकि आपको मैक्सिमम रिजल्ट मिल सके एंड विद मिनिमम कॉम्प्लिकेशंस। सो वील गो वीक वाइज। 3 to 4 वीक्स पहले इट इज़ ऑलवेज एडवाइजेबल कि आप अपनी बेसिक इन्वेस्टिगेशंस करवा लें एज वेल एज आप अपना स्लॉट बुक कर लें सो दैट योर मेंस्ट्रुअल साइकिल कैन बी टाइम्ड अकॉर्डिंगली एंड योर सर्जरी कैन बी टाइम्ड अकॉर्डिंग टू योर मेंस्ट्रुअल साइकिल। Then 2 weeks before, in case if you are having excess of coffee or in case if you are taking aspirin for some reasons or in case if you are smoking, just make sure that you stop all these things. Along with that, you need to stop alcohol, any kind of Ayurvedic preparations which might cause blood thinning, right? Then 1 week before the procedure, you have to take care of the fact that you keep maintaining a good perineal hygiene. In fact, when you have to shave the hair, you have to do it 2 days prior to the procedure, not on the day of the procedure, because इससे infection के chances increase हो जाते हैं. Then a night before, आपको एक दिन पहले क्या क्या precautions लेने होते हैं. See, the procedure will be done most probably in short general anesthesia, general anesthesia. So एक दिन पहले आप कुछ भी at least 8 hours before the surgery, you stop eating anything, and at least 6 hours before surgery, you stop drinking any kind of water or anything, right? Then you have to take a shower on the day of surgery. आप अच्छे से नहाएं at the day of the surgery and clean your perineal part properly. But you cannot use any kind of perfumed products. Use very neutral products. कोई भी perfume products को आप उस टाइम पे perineum पे नहीं use कर सकते because that might cause some sort of interference or infection post surgery. Then you need to relax yourself. See, relaxation is very important before surgery so that you can get a good induction at the time of general anesthesia and your vitals are also okay. The next thing is you need to wear comfortable clothing when you go and visit your gynecologist so that there are no tight clothings involved. Then obviously there is not going to be any makeup, jewelry, nail paint or anything. Just get rid of them and just go there wearing loose clothes. Now, what do we do? What do you do post surgery? Once you're done with the surgery, what do you do after that? So, on the day of the surgery, obviously, आप anesthesia के अंदर रही हैं. There are going to be a little bit of effects of anesthesia like nausea and vomiting. So, you'll not be able to eat for at least 6 to 8 hours after the procedure. So, you'll be receiving a drip. IV drip आपको glucose की मिलेगी. Along with that, in case अगर आपको कोई पेन हो रहा है, you can ask for IV painkillers. And in case if you are having nausea, vomiting or gastritis for that matter, ask your doctor or ask your nursing staff on floor to provide you medicines for the same. Now, we'll go sequentially. What to do about the movements, whether to move or not to move. कहीं stitches तो नहीं खराब हो जाएंगे, कहीं stitches टूट तो नहीं जाएंगे, या it's a cosmetic procedure, क्या proper result आएगा कि नहीं आएगा. So basically you can do bed mobilization because we want to avoid any kind of formation of clots in your body. So you can move your feet, you can move your legs from your knee joint, and you can do a little bit of movement in the legs. Then you can also place your legs on a pillow so that your perineum it gets relaxed. Then regarding the medicines, as I have already told you, you can ask for painkiller, nausea and vomiting की medicine. But जो narcotic painkillers होते हैं, they cause constipation also, and we cannot have any constipation. We cannot afford any constipation अगर perineum में कोई surgery हुई है, be that a normal delivery also. So in case if you feel you will not be able to pass motion properly या पहले भी आपको constipation कब्जी वगैरह रहती है, तो it's always better कि जैसे ही आपकी liquid diet के बाद soft diet start होती है, you start taking stool softener so that you do not have to strain at all और आपकी stitches पे किसी तरीके का कोई दबाव न पड़े. Then regarding aspirin or any ibuprofen या कोई भी blood thinner, ऑब्वियसली पोस्ट सर्जरी भी यू आर अंडर रिस्क एंड अप्रॉक्सीमेटली 2 वीक्स के लिए इट इज़ ऑलवेज एडवाइजेबल कि ऐसी दवाइयाँ ना लें जो कि ब्लड थिनर की तरह काम करती हैं. देयर आर मेनी अदर पेन किलर्स अवेलेबल जिनका ऐसा कोई भी साइड इफेक्ट नहीं है. सो डू आस्क योर गायनेकोलॉजिस्ट टू प्रिस्क्राइब यू द सेम. देन डाइट, कब खा सकते हैं, क्या खा सकते हैं. The procedure, it is usually done either under the local anesthesia or short general anesthesia. Patient immediately after surgery होश में आ जाता है, but still it is advisable कि 4 to 6 hours रुक करके उसके बाद they start with the liquid diet. Liquid diet के बाद they can start after 2 hours or 3 hours with a soft diet. Soft diet में क्या क्या आता है, like खिचड़ी, दलिया, maybe a little bit of dal, something like that. And it is very important कि आप अपने आप को hydrated रखें. The more hydrated you are, the better the results are going to be. Now, what activity you can do? Because obviously एक ऐसे place पे surgery हुई है जहाँ पर if you walk, it might affect your stitches. So हम चाहते हैं कि at least 2 to 3 days के लिए you take it easy. मैंने जैसे आपको बताया कि आप पैर के पंजों को हिला सकते हैं, घुटनों को हिला सकते हैं, but try not to move your hip joint that much. You can walk a little bit. अपने रूम में ही आप थोड़ा बहुत वॉक करिए like for 10-15 minutes and then let's take it easy. Then जॉब से आपको कितने टाइम के लिए छुट्टी लेनी चाहिए. सो आइडियली एनीवेयर बिटवीन 5 to 7 days इज ओके. 5 to 7 days के लिए यू विल बी नीडिंग अ लिटिल बिट ऑफ प्रिकॉशंस ऑल्सो. हम चाहेंगे कि आप कोल्ड कंप्रेसेस भी यूज़ करें, किसी तरीके का पब्लिक टॉयलेट ना यूज़ कर लें ताकि आपको कोई स्टिचेस को इन्फेक्ट होने के भी कोई चांसेस नहीं रहे. तो 7 days इज गुड इनफ. 7 days में यूजुअली सुपरफिशियल जो स्टिचेस होते हैं वो जुड़ जाते हैं. सो देयर इज लेसर चांस ऑफ एनी बैक्टीरिया पेनिट्रेटिंग डाउन बिलो इन द स्टिचेस या इनसाइड द स्टिचेस. सो इट्स ऑलवेज बेटर. देन व्हेन यू कैन exercise you can start anywhere around 3 to 4 weeks after the surgery. Obviously take it light on yourself. Start with simple walking, simple, a little bit of jogging at least 3 to 4 weeks after the procedure, and your body is going to guide you. आप धीरे धीरे करके अपना procedure, अपनी activity बढ़ाइए, not suddenly and not the initially. Then cycling, yes, you can avoid. You have to avoid for at least 6 to 8 weeks. Along with that, you have to avoid intercourse for at least 6 to 8 weeks for proper formation of the labia, for proper structure to appear, and obviously to protect your stitches also. Then driving, we recommend कि आप 2 से 3 दिन के लिए ड्राइविंग ना करें, but after that you are good to drive. जैसे कि आप अपना वॉकिंग स्टार्ट कर देते हैं वैसे आप ड्राइविंग भी स्टार्ट कर सकते हैं. A very important thing, at least for the next 3 to 6 weeks, it's always better to wear loose clothing, loose undergarments, so that आपके जो stitches हैं they do not get rub against, and the best cosmetic results can be achieved. Now regarding bath, कब आप bath ले सकते हैं? You can take bath the very next day, but make sure that it's a quicker bath and you dab the stitches just after the bath is done, and you do apply a little bit of antiseptic ointment or maybe povidone iodine powder or antiseptic, something like that. Cold compresses you have to do for at least a week so that there is no swelling there, or in case if there is minimum swelling it goes away. Now what about the dressing? कब तक dressing करनी है? So dressing can be done by you only in the perineal area for approximately 6 to 7 days. It has to be done. The stitches cannot be left open, and you can use a panty liner along with the dressing, and you can apply the ointment as I have already told you. But बहुत ज़्यादा over enthusiastic ointment apply करने से stitches जो है वो थोड़ा टाइम से पहले dissolve हो जाएंगे, and that is what we don't want. So use it maximum 2 times a day and minimum 1 time in a day. And the stitches usually they are dissolvable stitches, so इनको काटने की कोई ज़रूरत नहीं होती है. The stitches they get dissolved on their own. थोड़ी बहुत शुरुआत में irritation हो सकती है, itching हो सकती है. At that time you make sure to not to itch the area, but try and keep it as much as dry as possible ताकि आपको itching कम से कम feel हो या irritation कम से कम feel हो. Now what do you expect after labiaplasty? It's not all rosy, it's not all easy. It's not like you walk in and you walk out and you go back to your job, you go back to your life. But there can be a little bit of things that you need to know कि आपको क्या क्या problems हो सकती हैं, like minor problems. There can be a little bit of discharge. So अगर आपको वो वहाँ पे pain भी हो रहा है, if it's yellow, if it's foul smelling, you have to tell to your gynecologist कि it might be infected. That's the point. But if it is minimal in amount, then there's nothing to worry about. If it is not foul smelling or if it is white or creamish in color, then there's nothing to worry about. Then regarding the bruising, there might be a little bit of bruising because कहीं पर भी हम लोग vessels को cut करते हैं and along with that we stitch them together. There can be a little bit seepage of blood which can make the area a little bit swollen, but that little bit swollen area is going to get better with the ice packs and with the painkiller or anti-inflammatory that you are taking. Then obviously there can be a little bit of pain, a little bit of irritation or a little bit of itching. So a little bit of variability in the sensations that you feel down there. So be prepared for that. They are just really very minor. Then when you can expect the recovery? Total recovery, like functional also, you can expect in 6 to 8 weeks. 6 से 8 हफ्तों में total recovery हो जाती है. But initially stitches they get adhered, the stitches site they get adhered and stitches they get fall off by approximately 2 weeks to maximum 3 weeks post the procedure. Now what to do and what not to do? You can walk, you can do your regular routine works. And you can, there's no restriction with diet or anything. There's no restriction with the sitting job, the sitting work that you do. But there are certain things जो कि आप नहीं कर सकते. That is initially for first 1.5 to 2 months you cannot have intercourse. You cannot ride a bicycle, and you cannot take any kind of aspirin, blood thinners. You have to take a good care of your stitches. And that's it. That's the main thing that you have to do, and you have to maintain a good hygiene. Now obviously आपको approximately 3 days के बाद, 7 days के बाद and then 30 days के बाद एक follow up के लिए बुलाया जाएगा. But when do you need to tell your doctor earlier after a labiaplasty that you are having some sort of a problem, or when to expect that you have got some sort of a problem? So that main thing is, in case if you feel कि आपका जो stitch site है वो suddenly बहुत size में increase हो गया है, that might mean that there can be a little bit of pus collection there, या फिर कोई hematoma हो सकता है, like blood vessel has bled in through it and that area has increased in size because of the blood collection. Then in case if you have got discharge, excessive discharge, yellow color or green colored, maybe foul smelling, तो वो भी आपको डॉक्टर को बताना है because your stitches might be infected. In case if you are having excessive pain, then also you have to tell to your doctor. In case if you are having any kind of bleeding from the stitches, then also आप अपने डॉक्टर को बताएंगे. So grossly it is a safe surgery. The recovery results are pretty good. बहुत सारे non-surgical procedures भी labiaplasty के लिए available हैं. They also provide a good result, but surgical procedure is cost effective. The results are going to be permanent. There is not going to be need of any touch-ups every year, and in good hands you are going to get the best of the results. So in case अगर आपके पास कोई questions हो, please feel free to put them in the comment box and we'll try our level best to answer. In case if you want to book an appointment, you can call on the given number, or you can go through the website, see what the labiaplasty is, and then you can book an appointment with us. So thank you so much.